Hello and welcome to animatedteeth.com and our page that discusses what to do about extraction site stitches that have come loose or have fallen out before the 7 to 10 days that they're generally considered needed. In this video, we'll make mention of some of the more important points that we feel you should know about. As a start, when it comes to problems with sutures, it's your dentist, your treatment provider, who unquestionably has the most qualified opinion about what steps should be taken as a remedy. We can explain for you what's usually done, and what your dentist will consider when making their decision. But for your situation, they're the only one who has the all-encompassing view. And therefore, they're the one who should make decisions about your care. We'll also point out that it's their obligation, as well as no doubt an important aspect of the satisfaction they get from practicing, to make sure that your post-operative problems are tended to. So, take advantage of their assistance. As background information, it's important to understand why stitches are placed. The reason most people think of is tissue stabilization. And a common example of this is the situation where the patient's gum tissue at their surgical site has been flapped open so the dentist has access to their tooth. This is commonplace with the removal of impacted wisdom teeth. Afterward, when the wound is closed, stitches are used to tack the flaps back into place. Doing so idealizes conditions for the healing process to come. Sometimes a flap isn't formally raised, but the tissues still have mobility, like in the case where multiple teeth have been taken out in a row. If the dentist thinks that stabilization of these tissues will make the healing process go more predictably, they'll place some sutures. Probably less realized by patients is the fact that stitches are sometimes placed to help control extraction site bleeding. Take the case where, based on a patient's health history, the dentist has concerns that prolonged post-operative bleeding may become an issue. Placing stitches can be a way of applying pressure to the site, a step that typically aids blood clot formation. So, in understanding what possibly needs to be done about your lost stitches, if you've seen our pages that discuss extraction aftercare, you know that bleeding typically isn't a problem past the first day or so. So, if you have some stitches come out or loosen up on day 2, and they were placed to aid hemostasis, which at this point is controlled, that might not be much of an issue. But if they were placed for tissue stabilization, well, that's a different matter. Of course, it's your dentist who knows these kinds of particulars, not you. So give them a call. Here's an interesting graph that can give you an idea of how long sutures are needed. It shows how gum tissue flap strength, meaning tissue stabilization, increases over time. Take notice of the two dotted lines. They show when sutures are usually taken out, which is somewhere between days 7 and 10. Interestingly, you might notice that stitches are typically taken out when the tissue flap's strength is only about half as strong as it will ultimately get at the end of full healing. So even under normal circumstances, you still need to take things easy after they're removed. In comparison, if your stitches fall out early, well, the timing of the event means everything. If they loosen up on day 6, and if you take a little care, well, that shouldn't be a big deal. If they come out on day 4 or 5, and you exercise a lot of care in not testing or stressing your wound, that's not ideal, but possibly passable. If your sutures come out even earlier, well, you get the idea. And it takes your dentist's judgment to know what to do. A lot of their consideration will have to do with what's already occurred now that your stitches are gone. Is the positioning of your gum tissue still relatively intact? Having noticed pain or bleeding could be signs that it's not. If nothing has happened yet, is it likely you can protect your wound so disrupting it doesn't occur? Even if your lost stitches have resulted in tissue displacement, your dentist may decide that it's now a historic event and there's not much to do about it. This would be the case where the separation of the gum tissue, termed a dehiscence, is minor. In extreme cases, meaning the suture loss has led to substantial tissue changes, resuturing may be needed. And possibly the gum tissue's edges will need to be surgically freshened. Only your dentist can make all of these kinds of calls. So, once again, be in touch with them. Hopefully, you'll find that they feel all is well enough, considering. We will point out that there is additional important information on this page, so give it a read. And then, don't overlook that we do have additional pages that cover sutures, like details about how they're taken out, so look for those. And last, if you're having problems, good luck. But what we really mean is call your dentist. They expect you to. Goodbye.